doing a head-to-toe assessment, one of the most daunting components is the integumentary or the skin assessment. Here's the reality. You have to assess every inch of your patient's skin. You just have to. Now, usually we'll assess skin throughout our head to toe as we do other assessments on other parts of the body, but for the sake of this video, let's walk you through a specific integumentary assessment. First, you always make sure that you explain what you're going to be doing to your patient. The last thing you want is to start lifting their gown without their permission. So start at the head and face and work your way down. You're looking at the skin's color. Does it match their ethnicity? Are there any pigmentation changes? Do you notice any cyanosis, jaundice, or redness? Are there any wounds, lesions? Is it moist or dry? When you get to the patient's shoulders and chest, make sure that you pinch the skin over their clavicle to check turgor. You should see it rebound quickly. If you see it tenting, that might mean they're dehydrated. Then you can do their upper extremities. Again, looking for color, moisture, wounds or lesions, edema. Make sure you're feeling the temperature of them. Are they hot or cold? Are they the same on both sides? Look at their elbows and their bony prominences and other pressure areas. Again, you always want to assess on both sides compared side to side. If one arm is colder than the other, there might be some vascular issues. So then you can lift your patient's gown and start assessing their abdomen. Look for scars from previous surgeries, any swelling. You'll want to make note of things like freckles or moles. Then you can continue down and assess the patient's legs and lower extremities looking for the same things: color, temperature, moisture. You also want to make note of hair growth. Is there hair where there should be hair? If you see dark discoloration and an absence of hair growth on the lower extremities, that could mean they've got some venous insufficiency, especially if they're also cold. And of course, if you see any edema, make sure you're checking for pitting by pressing your finger into the swelling. You also want to make sure that you look at their fingernails and their toenails. What color are they? Are they shaped differently, like clubbed or spoon-like? And remember to look at their toenails, you have to remove their socks. So once you've gone head to toe on the front, you have to turn them over and look at their back. This part gets missed so much. Work head to toe again, paying close attention to pressure areas like the back of the head, shoulder blades, sacrum, and hips. Pressure ulcers can develop super quickly, so make sure you're paying attention. If at any point you find any lesions or wounds, make sure you get more detailed information like size, shape, color, drainage, and ask the patient how long it's been there and if it's painful. Now, once you've finished your skin assessment, make sure you're documenting any abnormal findings, dress any wounds as appropriate, and make sure that the patient is comfortable. So make sure that you also check out the outline attached to this lesson for more details on abnormal findings and what those might mean, and for a list of what to assess in the integumentary system. Now go out and be your best selves today, guys. And as always, happy nursing.